Now, I want to discuss the inguinal canal. Inguinal canal is an oblique passage through the lower part of the anterior abdominal wall. In male, it allows the spermatic cord. In female, round ligament. It starts from deep inguinal ring to the superficial inguinal ring. I know it is difficult for you to understand this, but I will discuss this boundaries and structure of the inguinal canal on a white board in a separated video. If we cut the skin subcutaneous tissue, here, this layer, if we cut it, we can see external oblique muscle, and this is the spermatic cord. If we cut another layer, we can see the internal oblique muscle, how it is passing, the way it is passing. Here, some definition, you can read it, but me myself, I will discuss it on a whiteboard for you. This is the defect in the external oblique aponeurosis we call superficial inguinal ring. And this is the inguinal ligament. This is external oblique muscle, and this is external oblique aponeurosis. The walls, anterior, posterior, roof, and the floor, I will discuss it in a whiteboard. This is lateral picture. Lateral picture. Coron section. Can you see this? External oblique aponeurosis going down and forming this structure. What is this? Inguinal ligament. Can you see? So the inguinal ligament forming the floor of the canal. This is spermatic cord. And anteriorly, the aponeurosis. Posteriorly, the union of internal oblique with the transversus abdominis muscle. Superiorly, this part of internal oblique. I know it is difficult for you to be discussed on a whiteboard, much better. The spermatic cord. Spermatic cord is a collection of structures. Can you see the S? It means not one structure. That passes through the inguinal canal. It begins in the deep ring and ended to the testis. This is a picture how the structure they are passing here. From the testis, epididymis, passing here in the canal. What are the structures of the spermatic cord? They are 3 fascial layers, 3 arteries, 3 nerves, and another 3 structures. This is how the spermatic cord looks like. This is the spermatic cord in one piece. Here we are opening the outer layer and showing you the veins, the nerve, the artery, the ductus deferens, and so on. Another picture showing you how the spermatic cord looks like and how many layers they are covering. Each muscle of them cover the spermatic cord with 1 layer. They forming external spermatic fascia derived from the external oblique aponeurosis. Cremastric fascia derived from internal oblique. Internal spermatic fascia derived from fascia transversalis and attached to the margin of the deep ring. If we finish the anterior abdominal wall with this opening and structures and canal, we want to see the posterior abdominal wall. It is formed in midline by the 5 lumbar vertebrae and their intervertebral discs. Can you see? These are lumbar vertebrae. Laterally, it's formed by the 12th rib, upper part of bony pelvis, psoas muscle, quadratus lumborum muscle, aponeurosis of origin of transversus abdominis muscle, iliacus, posterior part of the diaphragm. This is a picture showing you the posterior abdominal wall. Here, discuss each one from origin insertion. You can read it. I'm not going to discuss each one of them. Each one with origin, insertion, nerve supply, blood supply, and so on, and action. Facial lining of the abdominal walls. The abdominal walls are lined by one continuous layer of connective tissue that lies between the parietal peritoneum and the muscles. It is continuous below with a similar facial layer lining the pelvic walls. The fascia here, it has different name according to the region. For example, diaphragmatic fascia covers the under surface of the diaphragm. Transversalis fascia line the transversus abdominis muscle. Psoas fascia covering psoas muscle. Quadratus lumborum fascia cover the lumborum. Iliacus fascia over the iliacus muscle, and so on. We have one structure we call femoral sheath. Simply, it is downward prolongation of the facial line around the femoral vessels and lymphatics for about 1.5 inch, 4 cm, into the thigh, behind the inguinal canal. Because the femoral nerve lie outside the facial envelope, it has no sheath. Where are we in this structure? Femoral sheath. Can you read it? Yes.